Hi, Dr. Jonathan Pinna with Noble Choice Chiropractic, and today we're going to go over how exactly chiropractic helps with the disc injury that you may be experiencing right now. So with disc injuries, the classic presentation is that shooting pain down the legs. It can go into the butt, it can go down to the knee, and if it's bad enough, down to the toes in your feet. And so when we see those symptoms, they're pretty classic of sciatica and then possible disc injuries. And so when you have an injury like this, it's something that you want to get fixed right away. These kind of injuries don't typically improve on their own with time, with home remedies. It's usually something else that you need to be looking at to address it. In this instance, it's that pain down the leg, which is a nerve pain. And so when we look at the spine here, I've got a little mini model here. When we look at it from the side, this would be you standing from the side. This is the front and the back. We see these nerves coming out of the spine here at each individual level as we go. And so when there's a vertebrae in this spinal column, it's not moving how it's supposed to, then it starts to put pressure, irritation onto this nerve. That's what we call a subluxation as chiropractors. And so any joint that's not functioning how it's supposed to, then putting pressure onto the nerve, whether it's inflammation, it's tightness of the muscles around it because it's pulling, it's out of place, that's what's putting pressure on the nerve. Whatever that specific structure is putting pressure on the nerve, that's what we want to address in a sciatica. In the disc injury though, it's where we see in between each one of these bones, we have a disc, an intervertebral disc. It's a cartilaginous substance. It's like a jelly substance. And so when that disc here is injured, it starts to rupture out and then put pressure onto the nerve. And so we've got to fix that disc to take the pressure off the nerve to get rid of the pain you're feeling shooting down your legs. And so as chiropractors, very uniquely qualified when the issue's right here, and then we're going to address that structure around the disc with the adjustment. And so when you come into our office, we'll go through everything to determine exactly what you're experiencing with the history, the exam, the x-rays that we detail in another video. And then we'll go through, as long as we determine it's safe, it's something we can help with, we're gonna adjust the cervical spine. What that's gonna do is bring proper movement and function to each joint, which is really important because when you have dysfunction in your joint, that's when we start to have pressure on the disc more. When there's pressure on the disc, it's not how it's designed to be. It's impossible for that body to absorb that disc back in and take pressure off the nerves. So we want to return the normal function to the joint, get the normal motion, normal movement, and take that pressure off the nerves so you're feeling great. And so if you've seen any other videos on how an adjustment works, that's exactly what we're going to do. That's how chiropractic helps take the pressure off the nerve and eliminate the pain that you're feeling shooting down your legs. Excited to see you in here, excited to help you out, and look forward to seeing you soon.